Alright, so my group, we have the swim move, which is a pass rush technique in football, and it consists of 3 steps. The first step is going to be the swipe. You swipe with the outside hand, so it's going to be a left hand swipe. Step 2 is going to be the rise or the lift, where you come up, and then step 3 is going to be the follow through, where you break the hands off, just like that. So step 1 again, the swipe, breaking the hands off. Step 2, the lift, and step 3, the follow through, so you can come around and get to the quarterback. One is the swipe, and the first muscle we're going to talk about using is the serratus anterior, which is right where Terrell is pointing. And with the serratus anterior on the swipe, the left hand, it's abducting and protracting the scapula. It draws the medial border of the scapula away from the vertebrae while slightly performing an upward rotation. The second muscle of the swipe would be the pectoralis minor. It's also undergoing abduction during the swipe, and it draws the scapula forward and tends to tilt the lower border away from the ribs. Differently, however, from the serratus anterior, while the pectoralis minor abducts, it draws the scapula downward, thus slightly undergoing downward rotation. The step 2 of the swim move is the lift. So after you swipe, you lift with the right arm. And the first muscle we're going to talk about is the trapezius, which is right there where Terrell is pointing. And with the trapezius, it elevates the scapula while at the same time undergoing upward rotation, and that's the upper trapezius. The middle fibers of the trapezius elevate and upward rotate the scapula just like the upper, but differently is they also adduct or adduction, and they retract the scapula towards the vertebrae. Another muscle being used on the step 2 or the lift phase is the levator scapulae, and it's right there, kind of like on the back of the neck where Terrell is pointing. And with the levator scapulae, it elevates the medial margin of the scapula. Another muscle used on the step 2 lift phase is the rhomboid muscles. And the rhomboid is right there, kind of the upper midsection of the back where Terrell is pointing. And basically with those, the muscles work together, adducting the scapula, and accompanying the adduction is elevation due to the slight upward movement. The last muscle used in the step 2 lift phase is the serratus anterior muscle, which is right there on the rib cage area. And with the serratus anterior muscle on the lift, it draws the inferior angle of the scapula further from the vertebrae, thus rotating the scapula upward. Okay, the first move, well, the first muscle used for the follow-through phase would be the trapezius, specifically the lower fibers. And what they do is they undergo depression as he rotates his arm downward. Muscle used would be the levator scapulae, which is right there, the neck area. And what it does is it undergoes a weak downward rotation as he rotates his arm downward. Okay, the third muscle used would be the rhomboid major and minor muscles, which is right there again in the back area. And with those, from the upward rotated position, it draws the scapula down into the downward rotated position, just like that. The next muscle used in the follow-through step is the pectoralis minor. which is right there in the chest area. And with that, when the scapula is rotated upward, and it assists in depression, just like that. The last muscle used in the follow-through phase is the subclavius muscle, which is right underneath the clavicle area. And what it does, it also does depression, which is just the dropping of the shoulder, basically. Alright, so once you put all the moves together, it's quick and easy. Like I said, just a basic pass rush move, and it's like this.